A new proposal could make birth control free for millions of Americans. The plan from the Biden administration would require insurers to fully cover over-the-counter contraceptives.
It would mark the largest expansion of birth control access in more than a decade. For more on this, let's bring in Jennifer Klein, director of the White House Gender Policy Council. Jennifer, thanks so much for spending some of your afternoon with us.
Good to see you.
Thank you so much for having me.
Of course. So, Jennifer, explain for us what the impact of this plan would be, both from the doctor's office all the way into the pharmacy.
So as you noted, this would be the most significant expansion of birth control coverage in more than a decade. And when this rule is finalized, more than 52 million women who have coverage under the Affordable Care Act will be able to access free contraception after the rule is finalized.
So the rule would make over-the-counter birth control cost-free, but is there any concern that insurers would respond by increasing their premiums?
Well, what we know is that this will reduce costs for consumers, and all of the data show, we've done analysis before, and all of the data show that actually offering birth control without a prescription or birth control at no cost will lower healthcare costs for everyone. So we'll be going through the process, asking health insurers to give us their best information about how to do this. But we have full confidence that this can be done in a very cost-efficient manner.
We know that reproductive health has been in the spotlight for a couple of years now. Why put forth this proposal now, as Biden gets towards the end of his term?
Well, since the Dobbs decision came down overturning Roe versus Wade, we've been doing two things. First, fighting hard, which we will continue to do, for a federal law that would would restore reproductive freedom in this country. And the second thing the president asked us to do and the vice president asked us to do is everything we could by executive action. And that's what this rule that was announced yesterday would do. The president issued several executive orders, all asking us to think about how to expand access to abortion, but also to contraception and to IVF, which, as we've sadly experienced in this country, are also under threat since the Dobbs decision came down and since extreme abortion bans have been passed in states across the country. And at the federal level, Republican officials have attempted to pass 4 national abortion bans. This affects reproductive health more generally, and even contraception. So what this rule does is really, and it's been a long time in coming, we've done a lot of backup work to get to this point where we know that this rule will really deliver free contraception as people need it, make it more accessible, more affordable.
We're just 2 weeks away from Election Day, so how much of this announcement is a strategic push from the Democratic Party?
As I said, it's been a long time coming. Back in the spring, we issued guidance, which very much pushed in the same direction. It's particularly important right now that we do this because as of March, there is an oral contraceptive available over the counter. This rule will really do 2 things. The first is it will make over-the-counter without a prescription contraception free. That really matters, as I said, particularly because there's now an actual product on the shelves, but this covers all forms of birth control, of course, that can be purchased over the counter. And then the second thing is it will make more options available to people under the Affordable Care Act. So previously, people have been able to access preventive services, including contraception, at no cost under the Affordable Care Act. But there have been barriers, and what this rule aims to do is address those barriers. So yes, this is 2 weeks before the election, but it's just another example of what this administration has done under the vice president's leadership, under the president's leadership, to make sure people get the health care they need, and to make sure people, including women in this country, have reproductive freedom.
Director of the White House Gender Policy Council, Jennifer Klein, we really appreciate your time.
Thanks
for being with us.
Thanks so much for having me.